Hello guys, welcome back to another lecture of radiology. So today in this session we are going to study about the congenital heart diseases. As we all know, it is a very important topic and it is a very easy topic too. One question is a must from this topic, and the questions are usually very straightforward. The questions can be, they can ask you an egg on string appearance, they can ask you boot shaped heart, they can ask you a box shaped heart, right? So let us study the imaging features of various congenital heart diseases, as well as we will try to understand these imaging features also, right? So guys, the first image, okay, it is nothing, it is basically your egg on string appearance, okay? This is seen in patients with transposition of great arteries. So guys, what do you understand by transposition of great arteries? It means that aorta, instead of arising from the left ventricle, it is arising from the right ventricle, and your pulmonary artery, instead of arising from the right ventricle, it is arising from the left ventricle, right? So this is what you understand by transposition of great arteries. Now, what happens in this patient? You will see there will be narrowing of the superior mediastinum. And now guys, you might be wondering that the left sided circulation, it is not mixing with the right sided circulation, right? So how is the blood getting oxygenated? So just remember that these patients are always associated with some septal defect. So there can be an associated VSD, ASD or patent ductus arteriosus that is going to keep these patients alive, right? So blood from aorta, it is arising from the right ventricle. From the right ventricle, okay, from the aorta the blood is going into the body, from the body to the SVC, then RA, RV, okay. So basically there is no mixing of blood. So this mixing of blood happens through these septal defects, right? And just remember that it is one of the most common congenital heart disease. Right? So most common cyanotic heart diseases, right? Then most common in infants born to diabetic mothers. For survival, communication between right and left heart is essential, and that we have already discussed, right? Now coming to the next image. So how does this image look? If you look at this image very carefully, it looks like a figure of 8 appearance, or you can say it is giving a snowman appearance. So this figure of 8 or snowman appearance is seen in patients with total anomalous pulmonary venous connection. So what do you understand by total anomalous pulmonary venous connection? So guys, in a normal patient, what happens? All the pulmonary veins, these are draining into the left atrium, right? But in patients with DAPVC, the pulmonary veins, instead of going into the left atrium, they are draining into the right atrium. Now what happens when when the oxygenated blood from the lungs, okay, it is not going into the body. Instead of going into the body, it is going into the right sided heart only, right? It goes into the RA, RV, then lungs, then back to pulmonary veins, and again right atrium. So again, for these patients to stay alive, these patients are always associated with the ASD, or VSD or patent ductus arteriosus, right? So that mixing of blood can happen. Now, guys, because all the pulmonary veins, these are draining into the right atrium, you know, there is widening of the superior mediastinum, and this widening of superior mediastinum, it gives an appearance which is known as snowman appearance. Now, guys, we should also know the various types of total anomalous pulmonary venous return, right? So it can be of various types, type 1, 2, 3 and 4. So one is your supracardiac type of TAPVC, and just remember that it is the most common type of TAPVC. And what happens in this? All the pulmonary veins, these are draining into the superior vena cava, right? Then you have the type 2, which is cardiac, right? Here all the pulmonary veins, these are draining into the right atrium or coronary sinus. Then you have type 3, which is the infracardiac type. Here all the pulmonary veins, these are draining into the inferior vena cava, right? And type 4 is your mixed variant, which can be a combination of supra and infracardiac type, right? Now, guys, we have discussed total anomalous pulmonary venous return, right? Now, here in this image, you can see that there is a radiopacity seen along the right heart border, right? So, this is known as Schmitt's sign. And this Schmitt's sign, it is basically seen in patients with partial anomalous pulmonary venous return, PAPVC, right? So, what happens in this PAPVC? Instead of all the pulmonary veins draining into the right side heart, okay, here you have one single inferior pulmonary vein which is draining into the right atrium, right? And this inferior pulmonary vein appears as a radiopacity along the right side of the heart and this is known as Schmitt's sign. Clear? So, we should all know that this Schmitt's sign is seen in patients with partial anomalous pulmonary venous return. Now, here in this image, what are you able to see? So, this is a CECT abdomen image and this is your left side and this is your right side, right? So, here in this image, we can see that all the organs, okay, if you look at the liver, liver is normally present on the right side of the body and this is your spleen, which is normally present on the left side of the body. So, here the relationship of liver and spleen is reversed. Spleen is seen on right side and liver is seen on left side. So, this is a case of situs inversus. Okay. So, here you will see that the heart will be seen on the right side of the chest cavity, right? This is known as dextrocardia. Then you will see that liver will be present on the right side, okay, liver will be present on the left side and spleen will be present on the left side, right? This is known as situs inversus. Coming to another image, what are we able to see on this image? So, this is your characteristic boot shaped heart. Now, can you tell me boot shaped heart is seen in? Very simple question. Tetralogy of Fallot, right? So, what are the 4 components? This is the first thing that we need to know. What are the 4 components of tetralogy? The first is you are going to see stenosis at the level of infundibulum. So when there is stenosis at the level of infundibulum, that is your outflow tract of the pulmonary artery, right? So जब pulmonary artery के outflow tract में there will be narrowing, what will happen? Oxygenated blood will not be able to reach the lungs, and there will not be proper oxygenated of the deoxygenated blood, right? And because of the improper oxygenation, right, the patients will be cyanotic. Okay, the children will be cyanotic, right? Then you will see that because of the infundibular stenosis, the pressure in the right ventricle will be high, and that will result in right ventricle hypertrophy, right? Then there will be a ventricular septal defect, and fourth, you will see overriding of aorta. So what do you mean by overriding of aorta? It means that aorta it is arising from both the right and left ventricle. So if this is the right ventricle, this is the left ventricle, you will see aorta will be arising from both the right and left ventricle, right? So this is your boot shaped heart seen in patients with tetralogy of Fallot, right? So we have discussed all the four components of the tetralogy of Fallot. Now here in this image, what are we able to see? So this is the reverse 3 sign. So guys, can you tell me this reverse 3 sign is seen in patients with coarctation of aorta, right? So what happens in coarctation of aorta? Because of the narrowing of the aorta, right, the patients will have pain in the limbs, they can have weakness in the limbs, and they can also have unequal BP in both arms. Right? So this is the main problem. Because of the narrowing, there is decreased blood flow to the lower part of the body, and this can result in pain, and this can result in weakness, right? Now it can be of various types, right? Preductal and postductal. Preductal, there is long segment involvement, and postductal, there is short segment involvement, right? Now what happens in preductal type? What you will see? So if I draw the arch of aorta, and you see in the preductal there is normal origin of the left, there is normal origin of the right brachiocephalic trunk, right? Normal origin of the right common carotid artery, right? Sorry, left common carotid artery, and there is narrowing just before the left subclavian artery. This is what is happening in the coarctation of aorta. Narrowing कब है? Left subclavian artery के origin से पहले है. So one important sign that we see in these patients is inferior rib notching. Now we should know why are we able to see this inferior rib notching. Now guys, we have already discussed there is narrowing in the arteries, right? Now what happens when there is narrowing? There is decreased blood. Now what our body is trying to do? It is trying to compensate for that decreased blood supply to the descending aorta. Now, how is the body compensating for it? So, let me show you. Now, from the descending thoracic aorta, you have posterior intercostal arteries, right? Now, posterior intercostal arteries, they form anastomosis with anterior intercostal arteries. And anterior intercostal arteries, these are branches of internal memory artery, and internal memory artery is branch of subclavian artery. Now, what happens? What our body is trying to do? Our body, in order to compensate for the decreased blood supply to the descending thoracic aorta because of the narrowed segment, okay, collateral channels are forming between the posterior intercostal artery and anterior intercostal artery. Because these collaterals, these are running along the inferior border of the rib. If we know that the vascular, so we have already discussed that in preductal type, there will be normal right brachiocephalic, there will be normal left common carotid, okay. But there will be decreased blood supply to the left subclavian artery, right? Now, what happens in these patients? You will see that only right subclavian is normal. Okay. So, in preductal variety, you will see inferior rib notching only on right side, because in left subclavian artery also there is decreased blood flow, whereas in postductal type the stenosis is beyond the origin of the three great vessels, that is right brachiocephalic, left common carotid and left subclavian. So, in postductal variety you will see bilateral inferior rib notching. So, this is another very important difference between the pre and postductal type. So, here in these patients you can again see that there is notching along the inferior border of the rib, which is due to the collateral formation between anterior intercostal artery and posterior intercostal artery, right? Now, guys, coming to the next image, right? Coming to the next image, what are we able to see in this image? So, this is a characteristic box shaped heart. So, guys, this box shaped heart, this is seen in patients with Epstein anomaly. And Epstein anomaly, guys, what happens in Epstein anomaly? There is inferior displacement of the tricuspid leaflet. Because of the inferior displacement of the tricuspid leaflet, okay, there is enlargement of the right atrium, or we can say there is atrialization of right ventricle. And because of the because of the decreased diameter of the right ventricle, there is decreased blood flow going to the lungs, and this will result in cyanosis within the baby. Another very important MCQ from this is that it is associated with lithium use in pregnant female. Right. So, there is downward displacement of tricuspid valve and it is associated with lithium use in females, right. So, guys, let me just summarize all the congenital heart diseases and their appearances. So first, most important is the boot-shaped heart. It is seen in patients with tetralogy of Fallot. Then you have snowman appearance. This is seen in patients with total anomalous pulmonary venous connection. Then you have reverse 3 sign seen in patients with coarctation of aorta. Then you should know box shaped heart. This is seen in patients with Epstein anomaly, right? So these are the important congenital heart diseases and their imaging appearances which you guys should be aware of, right? Thank you and have a great day.